Wanna pass the NCLEX? Then let's get started. Today we'll cover 10 questions based on psychosocial integrity. Question 1. A nurse is caring for a client admitted with multiple injuries from a motor vehicle accident. Which action by the nurse is the priority in assessing for potential abuse or neglect? Ask the client directly if they have experienced abuse or neglect. Observe the client's interactions with family members or visitors. Review the client's medical history for previous incidents of abuse. Assess the client's physical injuries for consistency with the reported mechanism of injury. Pause the video and select your answer. If you chose option B, you are correct. Observe the client's interactions with family members or visitors. Observing the client's interactions with family members or visitors can provide valuable insight into potential abuse or neglect. Signs such as fear, avoidance, or overly controlling behavior from family members may indicate abusive situations. Question 2. A nurse is caring for a client exhibiting aggressive behavior on the psychiatric unit. Which intervention should the nurse prioritize to manage the client's behavior effectively? Administering a sedative medication to calm the client, using therapeutic communication techniques to de escalate the situation, applying physical restraints to ensure client safety, removing the client from the unit to a seclusion room. Pause the video and select your answer. If you chose option B, you are correct. Using therapeutic communication techniques to de escalate the situation. Using therapeutic communication techniques such as active listening, empathy, and validation is essential in de escalating aggressive behavior. It helps establish rapport, reduce anxiety, and promote cooperation with the client. Question 3. A nurse is conducting an assessment of a client admitted for suspected alcohol intoxication. Which finding would be most concerning and require immediate intervention? Slurred speech and unsteady gait, confusion and disorientation, respiratory depression and decreased level of consciousness, elevated blood alcohol concentration. Pause the video and select your answer. If you chose option C, you are correct. Respiratory depression and decreased level of consciousness. Respiratory depression and decreased level of consciousness are signs of severe alcohol intoxication and indicate a potentially life threatening situation requiring immediate intervention to maintain airway patency and prevent respiratory arrest. Question 4. A nurse is caring for a client diagnosed with terminal cancer. Which action by the nurse demonstrates providing support for the clients coping with life changes? Encouraging the client to discuss their fears and concerns openly, administering pain medication as ordered to relieve physical discomfort, facilitating a support group session for the client and their family, arranging for a spiritual counselor to visit the client. Pause the video and select your answer. If you chose option A, you are correct. Encouraging the client to discuss their fears and concerns openly. Encouraging the client to express their fears and concerns openly provides emotional support and validation, which is essential in helping them cope with the life changes associated with the terminal illness. Question 5. A nurse is caring for a client with a history of violent behavior. Which safety precaution should a nurse implement to minimize the risk of harm to staff and other clients? Assigning a one to one staff member to monitor the client continuously, placing the client in a private room with a locked door, restraining the client using soft limb restraints, allowing the client to roam freely within the unit under close observation. If you chose option A, you are correct. Assigning a one to one staff member to monitor the client continuously. Assigning a one to one staff member to monitor the client continuously is the most effective safety precaution to minimize the risk of harm to staff and other clients. This ensures immediate intervention if the client becomes agitated or violent. Question 6. A nurse is providing care to a client from a cultural background that emphasizes family involvement in decision making. Which action by the nurse best incorporates the client's cultural practices and beliefs? Encouraging the client to make independent decisions about their care, seeking input from the client's family regarding treatment preferences, providing written instructions to the client to ensure understanding, explaining the benefits of Western medicine and encouraging adherence. Pause the video and select your answer. If you chose option B, you are correct. Seeking input from the client's family regarding treatment preferences. Incorporating the client's family in decision making respects their cultural practices and beliefs, ensuring that the care is aligned with the client's values and preferences. Question 7. A nurse is caring for a client receiving palliative care at the end of life. Which action by the nurse is most appropriate in providing end of life care? Administering intravenous fluids to maintain hydration, educating the client about advanced directives and living wills, encouraging the client to participate in vigorous physical therapy, offering comfort measures and emotional support to the client and family. Pause the video and select your answer. If you chose option D, you are correct, offering comfort measures and emotional support to the client and family. Providing comfort measures and emotional support is essential in end of life care to ensure the client's comfort and dignity and to support the family in coping with grief and loss. Question 8. A nurse is assessing a client for potential substance abuse. Which finding would raise the nurse's suspicion of substance dependence? The client reports occasional social drinking with friends. The client exhibits tolerance and requires increasing amounts of the substance. The client expresses a desire to cut down on substance use. The client experiences mild withdrawal symptoms when abstaining from the substance. Pause the video and select your answer. If you chose option B, you are correct. The client exhibits tolerance and requires increasing amounts of the substance. Tolerance, the need for increasing amounts of a substance to achieve the desired effect, is a hallmark sign of substance dependence and suggests a loss of control over substance use. Question 9. A nurse is caring for a client admitted with injuries from an altercation. Which action should a nurse prioritize to ensure the safety of the client and staff? Implementing de-escalation techniques to calm the client, requesting security assistance to remove the client from the unit, placing the client in a private room with a locked door, providing emotional support to the client to prevent further aggression. Pause the video and select your answer. If you chose option A, you are correct. Implementing de-escalation techniques to calm the client. Implementing de-escalation techniques is a priority to ensure the safety of the client and staff during a potential volatile situation. Calming the client can help prevent further escalation of aggression and promote a safer environment. Question 10. A nurse is caring for a client from a culturally diverse background. Which action by the nurse best demonstrates cultural competence in providing care? Assuming the client's preferences aligned with mainstream cultural norms, avoiding discussions about cultural practices to prevent misunderstanding, consulting with an interpreter to facilitate communication with the client, implementing care interventions based solely on evidence based practice guidelines. Pause the video and select your answer. If you chose option C, you are correct. Consulting with an interpreter to facilitate communication with the client. Consulting with an interpreter to facilitate communication with a client demonstrates cultural competence by ensuring effective communication and understanding of the client's needs, beliefs, and preferences. Click that subscribe button and join us next Wednesday.